Welcome to Lesson 7. If you followed along since the first lesson, we've come a long way. We initially learned some important pronunciation rules and how to make ourselves easier to be understood when speaking in Spanish. We learned to focus on improving pronunciation with Spanish vowels, and we focused on some of the most tricky consonants, such as C. When does it sound like an S? Like in ciudad? And when does it sound like a K? Like in cuidado? G. When does it have a soft sound, like in gente? And when does it have a hard sound, like in gracias? And the double R, which for most people is really just, how do I make that sound? After this, we reviewed some of the common words that you're likely to use in physical and occupational therapy. These words were related to the body, to assistive devices, and to family members and friends. And after that, we really got into the good stuff. We started the process of learning Spanish verbs and how as beginners, we can focus on just one verb form for the time being in order to start creating original sentences in Spanish. And really, that's the key to this whole thing. These lessons allow beginners to use the context of physical therapy or occupational therapy to their advantage and are able to give patients instruction even without mastery of the language. Because remember, we're not trying to become interpreters. We're trying to become effective communicators, even with our limitations in Spanish. Now, I do hope you use these lessons as a springboard towards mastery of the language one day, but you're going to have many patients between now and that day, and your patients will certainly benefit from and appreciate a therapist who is able to communicate directly to them in some ways, even if it's not yet perfect. So let's take what we've learned about pronunciation, vocabulary, and verb conjugation to create sentences to say to a patient that they are going to do an action that you want them to do. In other words, we're creating descriptive sentences. If you're ready to go, let's do it. And if you're new, you're welcome along. But I'd strongly recommend a previous video because this is building off of what we just learned. Using descriptive sentences is one way to get across the idea to a patient that you want them to do some action. It certainly requires a sympathetic listener to fully understand you when you're expressing a need or desire through a description. But most likely, you have your patient's attention. They're on your side. They know that you're their therapist and that you are there to help them. And by greeting them in Spanish, you've shown a care and interest in them. You stand out more to your patient because you took the time and effort to communicate with them in a language that they best understand. Let's talk about the verb caminar and our subject of usted and conjugate the verb to create the simple sentence of usted camina. You walk. Now that we have our sentence usted camina, how can we use this? Well, we can use these sentences to provide a type of directive. So I could do something like this. Hola, buenos días. Soy Joshua. Soy de fisioterapia. Hola, buenos días. ¿Usted camina ahora? Yo camino. Conmigo. En el pasillo. Ah, sí, con usted. Sí, ¿caminamos? Sí, por favor. Vamos, porfa. Sí, caminamos. Vamos. This is an example of me using limited Spanish to get an idea across of what I would like my patient to do. And as a beginner speaker, I need to work with what I have. Now, obviously, I can't use this example with every patient I see. In my setting that I work in, rehab, some patients may be too sick to understand this more basic level of Spanish, or they might have aphasia and already have a significant degree of difficulty understanding a native Spanish speaker, let alone a beginner level speaker. But this is still an attempt, and I'm getting the general idea across of what I would like my patient to do, and I'm there to provide redirection or to remodel it further through demonstration. And if that's not appropriate, I have the option to speak through the use of an interpreter. And even if I need to use an interpreter, I've made an attempt to speak directly to my patient. I've demonstrated to him or her that I'm interested in their well-being, and I'm making an attempt to bridge that language gap that's between us. So, this is a start to communication. We've reviewed what a descriptive sentence is and how we can use it within the context of treatment time to guide and inform the patient of the treatment we want to provide them and what we would like them to be able to do. It's not our end goal, but we're setting the foundation for what we're going to build off of that. And in a simple way, it lets you get across the ideas you want your patient to understand. In the next lesson, we're going to progress our speaking ability into more complex and full sentences. We're going to learn how to be more direct with our patients and learn how to give clear directives in Spanish. That's right, we're going from descriptive sentences to directives, or mandatos. So let's look forward to that. As usual, ask questions in the comments and I'll get to answering them so I can provide better clarification. I look forward to your questions and comments. I'll see you in the next video.